Hey, Kelly. Well, the CDC just holding a call on some new data looking at how many people have been infected with the coronavirus. But first, really giving just a picture of where we stand with the trajectory of the pandemic. As we know, cases have been rising nationally, now up to about 44,000 per day on the 7-day average. That's about 23% increase week over week. Hospitalizations have also been rising nationally now for the second week in a row. In terms of admissions, now we're up about 7% week over week to more than 1,600 per day. And deaths, luckily, are still declining, down 13% to more than 300 per day. The CDC director pointing out even the nature of the hospitalizations is different. We don't see so much severe disease within those hospitalizations, which is good news. But of course, seeing hospitalizations rise is a metric that they are looking at very closely. They also note that this new sub variant of Omicron, known as BA2.12.1, which is 25% more contagious, it's estimated, than even BA2, now makes up about a third of cases being sequenced in the U.S. right now. And it really has a foothold, particularly around this region in the Northeast, but is expected to continue to gain as it is more transmissible than the previous version of Omicron, which was more transmissible than the other version of Omicron. Kelly, the interesting epidemiological information just coming out from the CDC is that as of the end of February, blood survey data suggests about 58% of Americans had been infected with the coronavirus. This does not include antibodies from vaccination, only from infection. And that number is much higher in kids than it is in older people. About 75% of kids under the age of 11, and the figure is similar for teenagers as well, are thought to have been infected, compared with 33% for people over 65. The CDC pointing out those numbers are essentially inversely proportional with vaccination rates. More older people are more highly vaccinated, Kelly. So kind of an interesting picture of where we've been with the Omicron wave.
Is the conclusion basically that the U.S., while it's struggling with yet another outbreak, has reached some kind or some level of herd immunity?
There is such a temptation to conclude that from this, and the CDC was just saying we cannot conclude from previous infection that we have reached a kind of herd immunity level, or that we should assume that this provides strong protection against future infection and severe disease. Of course, they're emphasizing it's important to get vaccinated even if you've been infected, but they do say this shows a picture of just how broad that wave was. And of course, the combined immunity that we see in the population, they think does have an impact on having less severe waves, hopefully going forward.
Very interesting. Meg, thank you for bringing that to us. Our Meg Terrell.